Before initiating our treatments, we have to monitor
Hello. Good afternoon, sir. Huddar, sir. Good afternoon. Good afternoon, sir. Good afternoon, sir. Good afternoon. So you can.
Good afternoon, sir. Voice
We
is
have.
audible, sir.
Yes, you are audible, and
Yes.
you can check once the slides
There.
are able to share.
Sharing options. Optimize for text and images. Share. Allow Alex to share your screen. Continue.
So you can.
How to share the screen.
Yes.
Share the window. Okay.
Once the slides
There.
are able to share.
Sharing options. Optimize for text and images. Share. Visible, sir.
Yes. Just make full screen.
I have done it. Full screen I have done, sir.
No, I am not able to see it now.
Okay. I'll just share.
Ready, sir. Good afternoon. Can you hear me? Hello. Ready, sir? Sir, you are muted. You are muted.
Dr. Manohar,
Can you hear
please.
me, sir? Yes.
Yeah.
Okay.
Please start. Yeah.
Shall we start, sir?
Yeah, please.
Okay. Hello. Ready, sir? Sir, you are muted. You are muted.
Dr. Manohar.
Can you hear me?
Yeah. Please start. Yeah. Dr. Manohar,
Sir.
so please start.
Yes. Yes, sir. So good afternoon, everyone. Welcome. Welcome for this today's webinar. This is the second webinar in the series of 5 webinars that has been conducting by CCRS, Ministry of Ayush, on the theme of the integrative cancer care Ayurveda's role. Yes, sir. So good afternoon, everyone. So welcome to this today's webinar. This is the second webinar in the of 5 webinars that has been conducted by CCRS, Ministry of Ayush, theme of the integrative cancer care Ayurveda's role. So sorry, there was a little technical problem. Some echo was coming, but now that is stopped. So I welcome once again. Good afternoon and namaste, everyone. To start with this webinar, I request our institute head, Dr. R. Govind Reddy sir, to please give the welcome address. Dr. Reddy sir. Sir, you are muted.
Thank you, Dr. Manohar. I'm very good afternoon to all. So, welcome to this second webinar of today's program. Is conducted by the CARI, Mumbai, and CCRS. I'm very glad that Ministry of Ayush and CCRS has given the opportunity for this program. I'm thankful to the Honorable Director General CCRS for my institution for the Integrative Oncology program for this 5 days, 5 webinar series. So today's speaker is Dr. Vitthal Huddar sir. He is an additional professor from the All India Institute of
Sir, I
Ayurveda.
want to speak something, so if I
Yeah, New Delhi. And
Sir, you are muted. You are muted, sir.
yesterday it was a very good response from the for the first webinar, and this webinar also we got the very good response. Yesterday it was more than 1300 participants participated of this program, and we are doing a lot of work on the this cancer research at TMC and ATTRAC. So we got the Center of Excellence recently. The Honorable Secretary Sir has inaugurated the Ayush Clinic at ATTRAC. So in these words, so even in Aya also, we are doing a lot of work, and we have the collaboration with the All India Institute of Ayurveda. And in future, we definitely work with the Aya Goa. Recently, Honorable CM of Goa has invited my institute technical in charge, Dr. Manoharji, for interaction with the this integrative to implement the integrative oncology at Goa, and even Aya of Goa. So I congratulate Dr. Manohar and the entire team of Dr. Manohar of the technical team for his good achievement of this program conducting, and we are getting the very good huge response from the for the participation. Today also I think more than 1000 participants as participating for this program. So thank you very much for Dr. Vitthal Huddar for accepting our invitation to deliver this guest lecture. And I again welcome to all the participants. Even some of my in charges is also there. My teachers is also there in this program, and many students of PG students, faculty, and all. I welcome to all. Thank you very much, Dr. Manohar.
Thank you, sir, for your welcome address and always support for all the activities. Thank you very much. Coming to the webinar again, it's my privilege to introduce today's speaker, Dr. Vitthal Huddar. Dr. Vitthal Huddar is an additional professor at Department of Kai Chikitsa. He is a postgraduate and PhD in Kai Chikitsa. He's a coordinator for Center of Integrative Oncology. This is a joint venture of All India Institute of Ayurveda, All India Institute of Medical Science AIMS, and ICMR NICPR, that is National Institute for Cancer Prevention and Research. He has also other responsibilities like Associate Dean for Integrative Medicine Unit, Associate Dean for Research, and is a member secretary for IEC IA at New Delhi. Uh, in all, he has more than 17 years of experience in teaching and research. He is engaged in several research projects of esteemed institutes and councils like IA, CCRS, AIMS, NICPR, IGIBA, and ILBS. He is a reviewer and editorial staff for many journals like BMG, Case Reports, JIM, IJHS, IUCare, IJAR, Jason, and others. He has published more than 25 national and international publications. Uh, he has been awarded with Government of Goa National Award for Excellence in Clinical Services by Shri Sripad Yesonai, the then Honorable Union Minister for State in Ministry of Ayush and Minister of State for Defense. Also, he got Ayurved Martand Award by AIPG Association. With this short, brief intro, although I have a big biodata, but I made it in a nutshell. With this brief introduction, we welcome Dr. Vitthal Huddar for this webinar to deliver his speech on to the second webinar theme, that is reducing Ayurveda for reducing the complications or improving the quality of life for the cancer patients. For the audience, I am happy to inform that today we got almost more than 1100 registrations. We are limited with the capacity for this particular platform, but the same is lively. The live stream is going on YouTube. I have shared the link in the chat. You may share with the interested who are there, who are not able to join in this platform. So with this, and I also request all the participants to kindly mute their self and until unless it is needed, because this will cause some inconvenience for the speaker, that the continuity for the speech will not be possible. So I request once again to please be muted. Whenever there is a question, you can post in the chat box, and also you can raise the hand for asking the question after the lecture. So with this, I request today's speaker, Dr. Vitthal Huddar sir. Uh, Sir, please start your lecture.
Yes, sir.
Thank you.
Okay. So good afternoon to all. And at the outset, I would like to thank the CCRS and the Kerry Mumbai, Govind Reddy sir and Manohar Kundeti sir to share my views on this great platform, webinar series on integrative oncology. And the part uh, which has been given for me to discuss is about the quality of life, improving the quality of life of the patients who are seeking Ayurveda treatment along with the conventional treatments. So this is a very important this one. Before that, let me share the screen, whether it is visible or not. Sir, is it visible?
It's visible. Perfect. Yes.
Yeah. Yes,
Thank
sir. Okay. So here, which is one of the most important component of the integrative oncology practice is improving the quality of life at present. Because based on the scenarios, understanding, and the evidences, and the conventional practices, everything looking to that, this is the emerging area where most of the integrative cancer practitioners are working to give more and more good quality of life to the patients who are seeking to Ayurveda. Anyhow, there will be a lot of patients which are visiting with a different purposes, even from starting from curative aspect to adjuvant treatments, and also as a quality of life improvements and prevention of recurrence, primary and secondary preventions. Lot of things are there, but still we are now focusing only on improving the quality of life of the patients who are seeking the treatment from integrative oncology, from Ayurveda especially. So, what I feel in this is it's a very crucial thing because very important also when a patient is taking a conventional treatment, lot of hurdles he faces. So most of the patients will reject sometimes the conventional treatment because of the side effects and the toxicity of the medicines, and they come to us saying that I don't want to go through that hurdle, and that's why I'm not going to take the treatment, and that's why we have came here. So we explain them the present scenario, what exactly the strength and the weakness of the each systems, and what to follow. We advise them in the clinics also. So in such a scenario, we need to address this burning problem where the patients are denying the conventional treatment sometimes. So that makes a lot of problems in the outcomes, and that's why that is going to influence on the treatment decisions and the outcomes also, because once the patient is afraid of those things, and he sees many patients who are taking conventional treatment in their home as well as in the neighbors, and they will say that, and they're suffering, and because of that one day they will not allow their family members also, and they don't insist others also to take conventional treatment because of this. So that's why this needs to be addressed. And another reason is there are some limitations in the conventional treatment which they cannot much address on these the issues which are generated from the conventional line of management. Hence the patients are seeking Ayurveda treatment also, and even not only the patients, even the practitioners, and even those the research areas and all, they are more comfortable, and they are seeking for the integrative projects in improving the quality of life, and many of them have done the research also, and it has been published. So this is nothing but the quality of life of the patient's perspective. If you see, the first thing the patient comes to us, then the thing needed is, because we can understand his agony, his pain, what he's going through, what is mental condition, what is his physical condition, everything we need to, but we are treating them physically also. But there are certain things which we can give more to the patients in the form of hand holding the patients. That is what we are going to do: the physical, social, psychological, and spiritual well-being, especially the quality of life, along with the physical, moreover is the social, psychological, and spiritual well-beings. That is, gives support to the patient, and he will prepare himself to continue with the treatment. He gets some hope in his life so that he can continue with his positivity. That also counts for the increase in the lifespan of the patients and this reduction in the symptoms. So that psychological aspect, definitely we know that anything which is going to affect psychologically, definitely it shows into the body also. So this is area where we need to work out. When the patient comes, understand his agony and pain, and then talk to him, listen him carefully. So that is very important, the first part of the consultation, and that also part of improving quality of life of the patients. So the integration, as I explained, because of the limitations of the standalone treatment, adverse events, and lack of curative treatments, and the patient demand for holistic and individualized care, as yesterday also we have seen, 70 to 80% of people are already consuming traditional medicines because of different reasons. One of them is improving the quality of life. So the scope for combining strength of both the system, particularly in improving quality of life and reducing the symptom burden. So in the other way, by reducing the symptom burden also, not usually the patient who will be taken for a quality of life of care is not an initial patient or in a first or second stage. It is at the end stage or the later stages of any cancerous conditions, where curative intent is almost nil, and only some chemotherapies, and to prevent the condition, prevent the progression in such conditions of the patients, they have to undergo conventional treatment. So in such conditions they come up with a lot of side effects. There the role of the quality of life improvement and also the reduction of symptom burden to that patient counts a lot, apart from the conventional care. So the key points in quality of improving the quality of life is, as I have told, the active listening. First, we need to understand a patient's unique needs, values, and the concerns, enabling the personalized treatment plans. And the symptom management, as I have told, the patients will be coming with the different symptoms at the time of the conventional treatment, that is pain, fatigue, nausea, and sleep disturbances, and many more. And psychological well-being, because they will be undergoing this all economical things, family problems, and these will cause them a stress, anxiety, and feeling of powerlessness. So alone, they feel alone, nobody is helping us, nobody is listening to me, my life has came to an end. That type of thoughts needs to be addressed in the psychological well-being. And the social and the spiritual health, so that is how the social relationship counseling of their the not only the patient, counseling of the patient attenders also, and their society, and give some education to them so that they can cope up and give a comfort to the patient so that they can continue their treatment. So improved outcomes. So because of this, obviously once the patient is physically becoming little fit and the symptom burden is going to be reduced, he will definitely continue with the conventional treatment or whatever our Ayurvedic treatment. So then definitely there will be improvement in the quality of life, survival, and these outcomes are also going to be improved. So there are many tools. I'm not going in detail with those things. These are all standard, validated, practiced all over the world. So majority of them are URTC, QLQ, C30 based questionnaires, and the ECOG performance status scale, and Karnofsky performance status scale, functional assessment and cancer therapy, FACT-G, and functional assessment of chronic illness therapy measurement system. So these are the major tools which we are using in each and every, almost in the research aspect, in the as a primary or a secondary objectives. These tools will be there in the research. So these are the standard considered as to assess the quality of life. So in practice, there are instances where integrative approach is needed. So there are many other areas. Prevention, primary prevention is there, and the add-on therapies, that is sometimes. So these are some of the other areas. I am not going to highlight much on that, but this part, that is adjuvant, prior, during, and the post chemo radiation. So in these areas where the quality of life will come, personalized dietary and lifestyle advices, adjuvant therapy, chemo and radio sensitizers, antioxidants, all these things, symptom management to improve the quality of life, immunomodulatory drugs and compound to regulate the cancer microenvironment. So many things are there. So here adjuvant, prior, during, and post chemotherapy and radiation therapies we can concentrate for that. So different strategies we have made based on the patients which are attending the integrative practices for Ayurveda especially. So chemo prevention, primary prevention, few of the patients will come, and in the second they will come for add-on therapies. Conventional is going on, but along with they want to have Ayurvedic treatments for different purpose. It may be tumor regression, prevention of metastasis, and so on. And in the strategy 3, the patients will come with a standalone treatment where sometimes the chemotherapy is not suitable to those patients because of their physical or aged patients, some comorbid conditions that may not be suitable for the chemotherapy or any radiotherapies. Such a patients, and due to some economic constraints also, the patients will come to us. So in the strategy 4, prevention of recurrence, again that they have taken the treatment, and they want a prevention of recurrence in a further in their future. And this is the one which we are going to talk now, that is strategy 5, chemo radio adjuvant therapies. The aim is to address the untoward effects of the chemo radiotherapy to prepare the patient in prior, so that the patient can tolerate the effects and expecting minimum untoward effects. And the presentations can be categorized as it's understanding that which you have done sama pittaja, vata pittaja conditions. Usually in radiotherapy and chemotherapy conditions, the patient presents with us with a maximum of these pittaja and associated with vata, sometimes kapha. It depends, but still majority of the times sama pitta and vata pittaja conditions usually we see, and based on those principles we are trying to treat them and reduce the symptom burden and also improve the quality of life. So here, before the radiation, chemo and radiation also we can give, so that we can prevent this one, and along with when the chemotherapy is going on, at that time also we can give. After completion of the radiotherapy also, some complications will be remaining for longer times. To address that also, all these in different areas, the quality of life role will come. So just to understand this in brief, I am not going in detail. This is just a overall look, that it is not exactly what I am going to say. Usually the patient comes to us, and most of them will be presented with these type of things. The predominancy of the doshas during the chemotherapy, vata pitta, post radiotherapy again vata pitta, after surgical removal and the debulking surgery is usually the symptoms of vata. And in relapsing conditions, usually the role of vata will be more. In palliative care, different, it based on the condition. And Agnimandya, Dhatu Dushti, Dhatu Kshaya, in all these conditions. And see, so these are the doshas, and the based on the stages and the different types of the cancers, the doshas are also different, but mainly most of commonly affected are Rasa, Rakta, Mamsa, and Meda. So if you consider these things, based on these we need to keep, because whenever a patient comes to us, it is not only the symptom means we need to, it may be a symptom or it may come with a disease format also, a Sankara Vyadhi we can say. For example, if the patient of lung cancer comes with a cough, he comes with a breathlessness, he comes with a cachexia, he comes with a hemoptysis. These are all individual symptoms. If they all together comes, we say it as a Rajekshma, and we use the line of treatment of Rajekshma, Shosha, Kshatakshaya, Urakshata likewise. So here, based on that, we need to understand definitely these side effects and the symptom burden in terms of involvement of the doshas and the doshas. Then only effectively we can understand the condition better, and the results also will be accordingly. So many conditions are there. We need to see these dosha, dhatu, mala, prakriti, agni, oja. So as in the previous seminar, the resource person was highlighting about the individualized medicine and tailored medicine. That also counts for this improving quality of life also, based on these all parameters which are involved in this. And these are not limited to these names of Arbuda, Granthi, Gulma, Visarpa, Vrana. Based on the different srotases are involved, different presentations. Almost all I can say in the patients in the practicing integrative oncology, we come across all srotasis related cancerous condition presenting with all different conditions and the diseases of different srotasis. So we should be aware about those things for the diagnosis, proper diagnostic purpose. So if you see the particular area of chemotherapy, I'm not going in detail with this. So based on this mucositis, chemoradiotherapy side effects like mucositis, hair fall, fatigue, diarrhea, constipation, nausea, vomiting, skin changes, all these things usually are symptoms of Vata Pitta, and the Vata Pitta are drugs like chemoradio adjuvants like Estimadu, Amalaki, Shatavari, Pippali, Kutaja, Bilva, Nisha, Vasa, such things. For a Brahmana purpose, again, Dhatu, Shevastar, different rasayanas can also be used, and different conditions we use these principles also. Nidana Parivarjana, Agni Dipana, Amapachana, Sruto Shodhana, Vyadhi Pratyanika Chikitsa. So all these things are also used in different conditions of these cancer patients to improve the quality of life and reducing the symptom burden. So the patients usually approaches to Ayurveda practitioner in the later stages, where usually Vata and Pitta are predominantly seen. Again, I have told that is the depends on the condition and the srotas involved. But usually, Kshina Bala, Durbalagni, and Ruksha and Ushna Guna is predominant in those patients, and the symptoms based on these gunas are also evident. So here we need to accordingly understand and treat accordingly. So we can think of, once we identified a dosha predominancy, we can go for Shodhana treatments. Few Shodhana treatments, all cannot be adopted. Vyadhi Pratyanika Chikitsa, Shaman and Rasayana, and Shodhana Panchakarmas can be adopted as per the condition of the patient. So the usually the rasayanas, usually this is a one weapon, or we can say it's the strength of our Ayurveda practitioners. It can be used as a naimittika rasayanas, as well as the swasthya rakshana, that is the regularly used rasayanas, naimittika rasayanas, particular diseases based on that, and the ajasrika rasayanas and the Nitya Rasayanas, like many things are told in Ayurveda, including the Rutucharya, Dinacharya, all these things will work out in different stages of the patients, in also treating as well as symptom, reducing the symptom burden, as well as the improving the quality of life of patients. So here, if we screen out all the Falashruti and the uses of these rasayanas, almost all are useful in the patient who has came into the later stages, debilitated, undergone chemotherapy and radiotherapy. In such a conditions, all these, the Falashruti of rasayanas seems to be fit. So what we can use based on the particular rasayanas, we can use based on the srotasas. So we can see Smriti, Meda, Balakara, Prabha, Varna, Swaraudarya, Vaksiddhi. So all these things, you can see the patients, Ojaksha Lakshanas will be there in those patients, which the Falashruti of the Rasayana has directly given that can be used. So again, different Falashrutis. If we go each and everything, so definitely we can see Nidra, Tandra, Shrama, Klama, Alasya. All these are the common symptoms which we see in the later stages of these patients, which is ruining the quality of life of a patient. So these are very important. Each one of them are very important. Even only one nidra, if you able to make that address, so it's a huge contribution for improving the quality of life. Okay, so daurbalya, anila kafa pitta samyakaraha, stairyakaraha, and abadda mamsaharaha, antaragni sandukshanam. So all these things, rather than going for any shamanaushadhi, these rasayanas are having more role, what I feel based on my experience. So this is about the rasayanas. And again, you can see these are the commonly addressed symptoms: toxicities, chemo and radiotherapy. What we can see in the rasayana falashruti, it is going to counteract these things: fatigue, anorexia because of radiotherapy, fatigue, anorexia, nausea, vomiting, alteration in the taste, sleep disturbance, headache, anemia, dry skin, constipation, and some of the late complications like pharyngitis, esophagitis, laryngitis, persistent dysphagia, fatigue, hepatotoxicity, infertility, and cognitive deficits. All these can be addressed with the different medications as well as the rasayana therapies. And in the chemotherapies, most of the symptoms what we are observing is nausea, vomiting, diarrhea, mucositis, alopecia, and constipation. So we have very good medications really to combat these things. That's why the number of patients in the OPDs are increasing day by day. And they are satisfied with all these, at least a symptom reduction in the symptom burden and the side effects of the chemotherapy and the radiotherapy. If you address that, is a lot contribution for those patients also. So here, few of the medications based on the practice, personal experience also, and from the different practitioners which they are practicing. Just I am giving some of the glimpses of those things. So if we think of reducing the symptom burden, definitely it is going to improve the quality of life of a patient, particularly if the pain, if it is there. If it is really related to the central pain or a neuropathic, in such a condition, Shodhita Bhanga, Trailokya Vijayavati, Kupilu contained yogas like Vishamushtivati, Agnitundivati, such things, or Vishatindukavati can be a contribution for managing the pain. And external therapies, obviously, for Abhyanga, Svedana, and Parisheka, who are fit for these, we need to check it again based on the doshas, Utklistavastha, and other things. We need to check and adopt the suitable Panchakarma and Dupakramas. And relaxation techniques, meditation, say different head massages, Shirodhara, some techniques. These techniques can also help the patient to reduce the pain to the certain extent. Obviously, in a severe conditions and the uncontrolled pain conditions, definitely we need to have a help of some allopathic medicines also. Again, which for a longer time they are not going to work for that, and then have a side effects on the renal hepatotoxicity. Such things are there. That's why the people are looking after this. So, lot of researches are also going on this for the pain management and the palliative care in the cancer patients. So anorexia in such conditions, Sitopaladi, Talisadi Churna, Yamani Shadavas, Pippalyasava, Guduchadi Kashaya, diet processed with the deepener drugs. This can be easily advised to the patients. So you can have some the particular medications like or any Dadimastaka or Vidanga or anything suitable to the patient that can be processed with the dietary preparations as per the customary things what usually the traditional things the people are following. Accordingly, this can be modified. So in cachexia conditions, Silajatwadi Loha, Ashwagandha Adilehya, Brahma Rasayana, most of the patients will will come with these type of symptoms. So Ashwagandha Adilehya and Brahma Rasayanas, Jivantyadi Grita, Deepani Yukta Yusha and Rasa, and Bala Siddha Kshira, Vidaryadi Kshirapaka, Pushpanda Rasayana, Sarpiguda. These are all very effective and wonderful drugs which we have to manage those side effects. And diarrhea, Rajanyadi, Dadimastaka Churna, Kutajaganavati or Kutaja Churna, Bilva Churna or Bilvavaleha, Musta preparations in different forms, again Musta Churna or any different preparations, and dietary modifications for diarrhea management. And for the vomiting purpose, Bilvadi Lehya, Mahimra Basma, Eladi Churna, dietary modification, Laja Sattus can be advised. Most of the patients will also come with this. Ela is also much we are using Mayur Pichabasma and Ela combinations and Kharchuradi Manta, and such mantas can also be advised because the patient is not able to take routine food. So urinary retention conditions will also be seen. So Chandra Prabhavati, Shiva Gutika, Punarnava, Gokshura. So such methods and Avagahasveda and Abhyanga Avagahasveda can also be practiced. So in the constipation, we have a lot of medications apart from the this one. So Kalyanaka Guda, Sukumara Grita, which will have the medicinal properties also in other way. They are going to correct the Agni. They are going to improve the Pachana, Deepana. So all these properties are there in these things like Katuki, Arogyavardhinivati, Yeranda Brushta Hariteki, etc. So for breathlessness in a lung cancer patients usually comes with a decreased appetite and digestion problems, constipations along with that. So in such condition, Nayopaya Kashayam with Dhanvantara Kutika and Shwasakutar Rasa, Pushkar Mula. So at different conditions, we can use some basmas also, Braka Basma and Shringa Basma can be useful in such a conditions to manage the conditions. And local Bharat Taila, Abhyanga and Nadisveda, even in ICUs also we are practicing this type of external therapies for the patients of lung cancer to relieve them, and they are much comfortable with these type of local therapies, upakramas also. So for a cough, and many of them will come with a dry cough rather than expectoration. So Balajira Kadi Kashaya and Sitopaladi Estimadu combinations we use usually Brahma Rasayana Chavana Prasha to maintain. Vardhamana Pipali Rasayana, if it is very chronic and Kapha Pradhana, then we can go for. And delirium and other conditions, Swarna Suta Shekhar Rasa, Pradhamana Nasya, Brahmi Vati, Kalyanaka Grita. So Kalyanaka Avaleha, which can be given. Lymphedema conditions are different things are there. I am not going in detail. So here overall the management of side effects of the chemo and radiotherapy, Vata Pitta Shamana, Rasayana, diet, the Pathya and the yoga. And the also we can consider the preparations which are told in Visha Chikitsa, like chemo and radio are considered as the Garavishas. So in based on that concept also Visha Chikitsa can also be adopted, Bilwadi Gutika, etc. So Brahma Rasayana, Amaliki Rasayana and Narasimha Rasayana in common. So you can see the publications also, Narasimha Rasayana, Brahma Rasayana and Amaliki Rasayana, protective effect of Rasayanas on cyclophosphamide and radiation induced damage. So for mental support, we have Medhya Rasayana, Sattva Chikitsa, Daiva Pashare Chikitsa and Yoga and Pranayama. And for yoga and meditation, many researches have also been done. Reducing the symptoms, it works in this way, reducing the symptoms of fatigue, sleep disturbances, anxiety, depression, and perceived stress. And psychoneuroimmunology and its role in cancer progression is also researches are going on, and regulates neuroendocrine axis, thus prevents carcinogenesis. Many theories are postulated, needs to be go further with a higher level of researches also. So these are the few therapeutic procedures based on the condition of the patient. We can adopt to Virechana, and some of the bastis, most of the times we are planning before starting any chemotherapy. Anvasana bastis, Matra bastis can be given. Post chemo and radio, you can give the bastis also. And Nasya, Lepa, Pradeha, Abhyanga, Mrudusvedana, Parisheka, Shirodhara, Shiropichu, Kavala Gandusha, Jalauka Charana. These few of the things can also be done along with the chemo and radiotherapy also. So few of the just one or two scenarios I am going to explain how we are going to see these cases, and in the quality of life how we are going to work out. So in case of oral cancers on radiotherapy, usually the patient comes with a severe dryness in the mouth, difficulty in swallowing, taste changes, and constipation. This causes a lot of difficulty to those patients. That xerostomia is a unsolved problem and burning problem for present conventional practitioners. So here the few things we can consider: Agnimandya, Amla Pitta, and the Rukshata present in the Sharira, Abhyantar as well as Bahya Rukshata, Ojakshaya conditions, Vibandha, Asya Vairasya, Aruchi and Arasamnyata. So these are few of the conditions where we can choose the medications and practice. So few of them, example, Estimadu Churna with Amalaki and Kamaduda, Avipattikara Churna Godanti, Madhuyasti Taila for oil pulling, Panchavalkal Kashaya for Gandusha, Shatavari and Mahatiktaka Grita. Grita preparations I have been practicing since that gives a very good result, switching to Gritas and the Avalehas for the maintenance of xerostomia and all, which is having very good results also. So in the similar lines, if we see the publications in impact journals evaluating Ayurvedic mouthwash and soda salt mouthwash for oral mucositis in head and neck cancer, a randomized control trial shows that the mucositis, pharyngitis and laryngitis and pain. So that is as compared to the control, it has given good results. So this is one publication. And protective effect of Estimado against side effects of radiation chemotherapy in head and neck malignancies. It has chemotherapy-induced mucositis was reduced to a greater extent by the Estimado Grita, which proves beneficial in two ways. There were no interruptions in the treatment because it has managed some of the side effects so that the patient has continued the treatment and food intake was not severely affected. So he was tasting well, dryness is less, salivation is good. So in such a conditions, they enjoy the food and they take, and the balai of the patient is going to improve. Definitely, it is all concerned with one or the other interlinked. So other are herbal medicines for xerostomia in cancer patients, a systematic review of randomized control trials. Herbal medicines had a potential benefit for improving salivary function and reducing the severity of the dry mouth in cancer patients. And Ayurvedic drug Trifla in combination with providone, iodine, mitigates radiation-induced mucositis in head and neck cancer patients without affecting the tumor response. Trifla coupled with the iodine was more successful in preventing radiation mucositis and without affecting the killing of the tumor cells than the iodine gargle alone. So this is another one, efficacy of Rasayana Avale in adjuvant to radiotherapy and chemotherapy in reducing the adverse effects. So in the lung cancer patients, just another example, the patient usually cough with a dry cough or sometimes with expectoration or hemoptysis, breathlessness, shortness of the breath, fatigue, low appetite, significant weight loss, cachexia and chest pain. So side effects of the chemotherapy here, nausea, fatigue, loss of appetite and hair loss, possible impact on the renal functions. So conditions to consider, Rajakshma, Kasa, Shwasa, Agnimandya, Aruchi, Chardi and Urakshata, particularly in hemoptysis conditions. So considering these, we can practice Varnamalini Vasantarasa, Brahmarasayana, Agastya Rasayana, Pippali, Estimadu, Sringabasma, Nayopayam Kashayam, Yeladi Gutika, Rasayana Churna, Dhanvantara Gutika, combination of Sitopaladi Estimadu, Tankana, and Tanakantamani Pisti, wherever there is bleeding, such things are there. We are practicing these things in those patients to handle the symptom burden, as well as improving the quality of life. You see, in such a lines, we have published one article on that, exploring the therapeutic synergism of Vardhamana Pippali Rasayana with the standard of care in non-small cell uh, lung cancer. So this is, you can see here, the dyspnea has reduced significantly, cough has reduced significantly from 100 to 16, hemoptysis has came down, sore mouth, and these were not there to the patient. And this is a one study which has been done with AIMS Delhi and AIA Delhi. So this is the result of that. Along with the chemotherapy, Vardhaman Pippali Rasayana has been administered, and it has given significant, not much challenging like curative aspects, but at least reducing the toxicities, improving the quality of life in the symptom burden has reduced a lot. Okay, so this is another related lung cancer related publication, a comprehensive management of stage 4 lung cancer through Ayurveda, a single case study. So again, you can see here the blackish discoloration, visual acuity, cough, shula, all these things have been reduced. So this is, as I was telling about, an open label 2-arm exploratory randomized controlled trial to evaluate the effect of Vardhamana Pippali Rasayana as an add-on therapy in the management of non-small cell lung cancer. So this is yet to be published actually. So this is one project and the PhD work which has been conducted. So here you can see the orange line is about the group B, and the group A is Vardhaman Pippali group A, the patients of group A. The clinically significant improvement in cough among the patients of group A as compared to group B. Okay, so that is the reduction as compared to here, and see the patients here. And this is the one about the cuff. And see the hemoglobin also. Group A better outcome, statistically significant difference between the two groups favoring Group A at second and the third cycles. That is, it is increasing the hemoglobin levels also. You can see at the end of the treatment, at the starting of the treatment, you can compare the two lines here. So uric acid, again the uric acid level has came down. Peripheral neuropathy has significantly reduced. So many other things like the TLC and the platelets, they were as compared to the control, the TLC and the platelet level has not dropped. So that is also a very important observation in that study. So quality of life, Vardhamana Pippali Rasayana shows better improvement in global health perception and physical functioning. So in the scenario 3, the colorectal cancers, the patient comes to us with a passing loose stool 7 to 8 times episodes per day, reduced appetite, weakness, weight loss. And in these conditions to consider Atisara, Grahani, Pravayika and Arshas, Putajaganavati, Bilvavaleha, Kankayanavati, Basti, looking to the condition of the patient, Shalmali Niryasa, Dadimastaka Churna, Sukumara Grata, Changeri Grata, these can be practiced along with the chemotherapy, also safer practices. And these are definitely helpful in such a conditions. We can contribute in such cases. Only 2-3 where maximum you can contribute I have taken. Many other conditions are there. I am not going in detail to that. So many other publications are there related to the reducing the side effects or the quality, improving the quality of life of the patients. Rasayana drugs from the Ayurvedic system of medicines as a possible radioprotective agents in cancer treatment. So radioprotective effect of the drugs of Amrita Prasha, Ashwagandha, Rasayana, Brahma Rasayana, Chavana Prasha, and Narasimha Rasayana and Triphala has been proved. Effectiveness of combination of Ayurvedic drugs in elevating drug toxicity and improving quality of life of cancer patients treated with the chemotherapy. So here, based on these, the nausea, loss of appetite, constipation, and fatigue, there was a significant improvement in Kaposi score and in the quality of life QLQ score. And the role of chemo recovery kit with Ayurvedic formulations containing coral in the managing chemotherapy adverse effects and maintaining quality of life in breast cancer patients. Chemo recovery kit with a coral is highly effective in management of chemotherapy-induced nausea, vomiting, fatigue, and skin discoloration, and thus to improve the quality of life is the result of this study. Another study is efficacy of Rasayana Avaleha as an adjuvant to radiotherapy and chemotherapy in reducing the adverse effects. Rasayana Avaleha has proved to be an effective adjuvant therapy in protecting patients from the adverse effects of chemotherapy and radiotherapy. Ayurveda for chemoradiotherapy induced side effects in cancer patients. So many things are there. Classical Ayurveda management of TCH based chemotherapy induced peripheral neuropathy, a case report. Prospective randomized trial of standard antiemetic therapy with yoga versus standard antiemetic therapy alone for highly emetogenic chemotherapy induced nausea and vomiting in South Asian population. Large scale studies have been done and published in a good impact journals. So overall, based on these all efforts, when the patients are coming to us, the outcomes of this improving the quality of life is better tolerance to the cancer therapies. That means we are making some contribution there. The conventional therapies, they are going to tolerate it. Either you can start it earlier, or we can start it in the during the chemotherapy or post chemo radio. In any way, better tolerance to cancer therapies. Enhanced physical strength and immunity, very important, which is again going to contribute to the outcome of the treatments, which along with the conventional treatments. Reduced fatigue, pain, nausea, and insomnia. These are major 4 things which are mostly seen in those patients. Improved mental clarity and emotional stability, that is very much needed to those patients. We need to listen them, we need to interact with them, we need to give them a time. The most of the times the patient complaints or the physician doesn't listen and doesn't give time for them because it's only meant for what is the condition is and what treatment I have to give, nothing to be contacted in touch with. We need to contact with, we have a connection with the patient, need to understand what patient is feeling exactly, then only we can deliver, we can connect to the patient and give a good relief psychologically, as well as that is going to affect definitely on the physical part. So greater sense of well-being and hope to the patients, and rather giving many a times many we have seen that giving high ambitions and giving more hopes, that is also not a part of that. But still, the patient should be withhold and with the realities, that type of counseling can be done. And many challenges are there. Again, limited large scale clinical evidences are needed, as it was discussed in the last webinar also. So large scale studies are needed to prove these things, because even though we are practicing and we are prescribing it to the lot of patients, and they are benefited also day by day, number in my clinic also they are increasing, we are not able to even see those patients, that much of burden is coming, because they are getting results. So that is true, and 70 to 80% of people are already taking. Only the thing is we need to make a systemic. So the efforts are going on. It's not a start actually. It's a lot of things have been done. We have seen the publications also, and we also have been collaborated with AIA Delhi, and we are working with NCA. Our center is there in NCA Jajjar also. So there also we are working with these sort of things, where the quality of life improving and with a safer drugs, with a single drugs, minimum drugs. So that is a low hanging fruit for do the research, the quality improvement in the quality of life, that can be as a starting point. So need for integrative oncology centers, it's a need. We have seen many centers are there right now, and there should be a need for a model integration. As yesterday also it was being told that the integration is not that the patient is not only I can take both, it comes the patient is taking the different treatments, but the real actual integration is with the between the physicians. So one, we can understand, we can convince them with our evidences, and then only once the both the physicians from the Ayurveda and conventional system or allopathy, they will understand, then only the integration is possible. Okay, so importance of multidisciplinary collaboration is needed. Scope for personalized Ayurvedic protocols is a need. So the remarks I want to give at the end is the Ayurveda is going to definitely enhance the quality of life in cancer patients. More researches are needed definitely. Acts as a supportive and integrative therapy, focus on holistic healing, that is including body, mind, and spirit, not only based on the tumors or regression of the tumors and all, which is needed, but along with that, holistic healing is also needed to counteract most of the times the physical illness as well as the mental illnesses, and spirituality is also needed. In the future, stronger evidence-based global acceptance is a target. We need to achieve these things. So this is about the my few experiences related to quality of life management improving in case of cancer patients. Thank you. Open for question answers.
Thank you, sir, for your very nice and illustrative presentation on your experiences about how to reduce the toxicities and how to improve the quality of life for the cancer patients who are undergoing the chemotherapy and radiation. So, along with various examples, you have illustrated very nicely. Now the floor is open for questions. The participants are requested to please post their questions in the chat box. And as of now, there are two questions.
Two
Sir,
questions, I think.
yeah.
Yeah.
So I will take the first one is Namaste sir. Is there any evidence of drug interaction between Ayurvedic drugs and chemotherapy drugs? Actually, some doctors say that Ayurvedic drugs can interfere with how chemotherapy drug work, either by affecting their effectiveness or increasing their toxicity. Kindly
Yeah.
guide, sir. Dr. Manisha is there. Yeah, sir.
So definitely, this is the burning problem which we are also facing while making the integrative projects. The first question comes in the ethical committees is the drug interactions. So right now, extensively, we don't have drug interaction studies, but still in our PG scholars and the PhD scholars, few of them have worked on drug interactions in particular areas, where it has been interestingly shown that in a particular dose, it is going to uh, enhance the drugs which intended to work, and certain doses it is going to inhibit. So that is there. Definitely, we need to explore that. Few studies are started now. We are in that direction only. Most of the studies in the future we are giving with the drug interactions only. Now, how we are making overcoming with that drug interaction is we are going to take safer drugs, single herbal drugs, or in the different forms which have been told in the classics, which is given, and we are in practice, we are advising them to take these medicines little bit. The once they are taking any allopathic medications, we ask them to make a gap of at least 45 minutes to 1 hour and then take. So that's going on right now. Definitely, that is the area need to be explored.
Okay. So thank you, sir. Yesterday also this was discussed in the yesterday's webinar. And to just add to the information to the audience is that the MSKCC, they have a website, and on their website there is a portal for herbs and interaction data is there. So many of the commonly used Ayurvedic herbs like ashwagandha and other things, they have documented or they have made some collection together where we can see that interaction data is available there. Sir, going to further next question, it is by Dr. Hemalata Dubey. Madam is asking about, sir, can we use Hirak Bhasma in made cells scattered into bone marrow? That is, he wants to ask, I think, in the metastasis, can we use Hirak Bhasma?
Sir, can you repeat that? In which condition is asking?
It's a bone metastasis, I think so.
Automatically.
Okay. So Hiraka Basma is used in many of the conditions, including bony metastasis also. So usually that is we are using that as a rasayana again. Rasayana, Swarna Basmas, Hiraka Basmas, that we are using as a rasayanas. In many conditions, commonly it is used, and it is true for that bony metastasis and other conditions also.
Okay, sir. Another question is that, Namaste, sir. It is by Dr. Ashwini. She is asking, Shodhana can be done in cancer patient.
Yeah, definitely it can be done, Shodhana, but we need to see the condition of the patient. Most of the times, it is the patient condition which they come to us. It restricts us to go for vigorous panchakarmas, but we can go for Nasya, we can go for Basti, and many Upakramas also we can go for. Different varieties of Basti can be practiced safely. Such a patients, and again, Dhumapanas in the few patients can be practiced. Not exactly the Vamana and the Virechana, certain extent Mrudu Virechana can be given, but personally, Vamana and other conditions, we are using in a patients to prevention for recurrence. In such a patients, we are using those Shodhana conditions.
Okay. Sir, the next question is Muhammad. Dr. Muhammad is asking, Namaste, sir, where one concept you had mentioned, Vishahara yogas to counteract chemo and radio side effects. So whether we can correlate all these side effects of chemo and radio under Garavisha, where Acharya clearly explained Viruddha Aushadhi Bhasmanam in the Nidana of Garavisham, considering whole chemo and radio as Alpa Virya Visham, where patients are consuming. So all these scenarios can be considering under concept of Visha.
Yeah, there is a concept of Visha always. There is a concept I used to tell. In even in the same thing comes to in skin diseases also, in many other conditions also, where the symptoms will come, whether either it is by because of any drug induced conditions, and such condition definitely it can be. That's why I have kept it, but not exactly. It's 100% means we are going to go on a Visha Chikitsa, but a few of the drugs in a particularly suitable conditions can be used. But definitely apart from that, there are scope of other conditions, dosha as what I have mentioned, and there are sometimes the patient comes with a vyadhi only. So in shwasa kasa rajakshma like features are there, only visha chikitsa to take. The consequences is that one of the reason is this, main reason is that, but the consequences will present in different aspects also. We need to understand, and genuinely we need to select the visha chikitsa dravyas, and also in general rasayanas also. Most of the times rasayanas rather than the visha chikitsa, the such rasayanas which will do having a vishagna property likewise can be wisely used.
Okay. So the next Dr. Hemalata, she is asking, sir, can we use Guduchi along with chemo?
Definitely, definitely. Guduchi can be used with chemo, no problem. But in a certain dose, high dose, if you are going to give, then it may cause sometimes gastritis to the patients, acidity, hyper, such symptoms may come. Just see and observe the patients and decide. Definitely, it can be given, no problem. We are practicing that.
Okay. So any other participant they wanted to ask, they can raise their hand so that they can we can make them unmute and they can ask the questions. But before that, Dr. Bhavin is also asking one question. Sir, any data regarding the role of Panchashirisadi Agad in cancer patient?
No, I have not tried it personally. I am not having any much idea about that.
Okay. So I think I'm not seeing any questions now, but maybe, sir, coming back to again the question of drug interactions. Sir, there is another one portal called as Efficasafe, that is EFFICASAFE, Efficasafe. This is a portal developed by the Society of Integrative Oncology. And this is again a good database for to see explore the drug interactions or especially herb drug interactions like chemotherapy drugs are there, that is carboplatin is there or cisplatin is there, along with whether we can use ashwagandha. So it's another good portal. Sir, now we have one question again. Dr. Hemalata is asking for platelet count, goji berry and karkat decoction.
No, sorry, I don't have idea. No.
And another Arya is asking, Namaste sir, will Agnimandya correcting medicines will increase the difficulties after chemotherapy with increased pitta?
Okay. So there again, we have to see that because of that, there is a visheshan of pitta, and whether it is the guna of the pitta, what we say in the amla pitta and rakta pitta, also we see the qualities based on the qualities of the pitta. Then only we are adding the medications. In some conditions, we are using tiktarasa katuipaka and shitavirya dravyas to combat that. Madhurarasa madhurayupaka shitavirya dravyas to combat the pitta. Where to go for some of the tiktarasa and Katuipaka and Ushnavirya drugs also we use for the Deepana purpose. So this all depends on the qualities of the pitta, what you are exhibiting, the patient is exhibiting. Based on that, we need to select those drugs.
Sir, one question Muhammad is asking, sir, any idea about using Mahavisha or Upavisha dravyas in symptomatic relief? I think he wants to ask about pain as Savgna Sthapana dravyas.
Yeah, Kupilu one I have mentioned actually, Kupilu, and again this one the Vijayavati and all other things. So these things we are using right now with a limited actually practice. I can say in the Vishadravas very limited like Bilva, Dushi Visharya Gada. These things we are using in practice, not extensively as the Vishas and other things. All of them have not been explored.
Dr. Hemlata is asking, can we use papaya leaf tea for platelet count?
Yeah, definitely. We can use it, and in the market also, those preparations are also coming, and we are using that, and they are giving good results also. So apart from our concepts, also whatever the research is showing, that also we can use, no problem. We are getting results also in that. We can use it.
Okay. So I think Dr. Dattatreya has mentioned about the Efficasafe herbal supplement drug interaction database is there, correct? So, sir, any other question? They can raise their hand, or Dr. Reddy sir, you want to comment or some
Dr. Manohar,
any
it's a
comment?
very good interactions. So many questions raised by the many participants, and it's a very good, that means excellent lecture by the Huddar sir. So I think there is no. That means if any come back, that means if any questions, just you may ask by the participants.
Yes, yes.
Yeah.
So, sir, there is one query is that, sir, in Singapore we can't use Basmas. What are the alternatives?
Yeah,
I
a
think
lot of
Dr.
alternatives.
Herbal drugs also we can use.
Yeah, a lot of alternatives are there. We are
Yeah.
using most of them as herbal only because we know few products of basmas which are safe and other things. We don't know about all others also. So, and clinical studies are also not there to say that. But on the safer side, we are using most of the herbal drugs only in our practice also. But standalone treatment, we are using all the basmas. But particularly in quality of life and in the along with the chemo and radiotherapies, usually we are using with grata preparations, avaleya preparations made with the herbal drugs only.
Actually, in my own experiences, I have treated hepatobiliary cellular carcinomas with the Hirak Basmas. So we are getting the very good results. And even Suvarna Basma is also very good results in the quality of life of the patients. Many patients I am putting on the Suvarna Basmas, those who are affordable patients. So I have the many patients. So we are using in my center. We are prescribing. So we are getting the very good results in the quality of life of the patients. Yeah.
Dr. Shashikala, she is asking, sir, any specific medicine from Ayurveda to improve strength, stability of cancer patients?
Again, the rasayanas which you have mentioned, Kushmanda Rasayana, Brahma Rasayana.
Correct. Narsimha Rasayana is there.
Narasimha Rasayana. Yeah.
So that's what you have mentioned in your presentation. I can't see anything, but as sir is talking about, but in the country like in India, sir, we have like affordable cancer care is always our aim and challenge. To considering that, I think all what the propositions Dr. Huddar has shared, these are the formulations.
Yeah.
Along with chemotherapy and radiotherapy, definitely they will reduce the toxicity and improve the quality of life. But the another advantage is that this makes the patient to compliant to their ongoing treatment. So the treatment adherence becomes important when there is some to in terms of outcomes, because some when you are treating a patient and reducing the toxicity, he will comply to the chemotherapy cycles, so that that will be the treatment will complete and the outcome will be definitely better than when he is not having the complete treatment. So that is another one aspect when we talk about this particular topic. One comment, I think this is a compliment. Wonderful presentation, Dr. Uddar. It may help us to go ahead and treat the cancer patients. Congratulations, Dr. Abdul. Could you we refer our patients to your center? Yes, definitely. IA is open and there are now many centers are there.
Yeah.
So,
Yeah.
Sir, I think we are coming to the end of this particular session now. If there are any questions, they can be writing to directly to Dr. Huddar. I will post his email ID again. Sir, one last question we'll take. Sir, Avaleha Rasayana are Guru in Guna. How can we give it in patients of Agni Mandya receiving chemotherapy or radiotherapy? Dr.
Yes,
Huddar?
yes.
Yeah.
That's a good question. Actually, initially, when the patient comes with a severe Agniman and such conditions, usually we advise very few medications along with the dietary modifications and the liquid diets, Yavagos, Yusha, Manda, likewise. So once the patient slowly improves, then we go for the preparations of Grita and the in medium, along with some other medication, Deepanapachana drugs, continuing it with that Grita preparations. And once the patient is good enough to digest the things, then only we switch on to avaleha preparations. Till that, we are not going to advise avalehas directly to any patients who are having very mandagni. Yeah.
Yes. So seeing the condition of the Agni status that you are going to treat the patients. Exactly.
Yes,
Uh,
definitely.
Dr. Neha Sharma, please paste link of website mention of data related to drug. Yes, definitely we'll share that. I have posted the email address of Dr. Huddar for your kind reference and any further questions on this particular topic and any in this particular domain. Thankful for greater explanation and showing use of Ayurveda as an integrative therapy. Okay. So, so thank you very much, sir, and thank you all the participants
Thank you.
for making this
Thank you,
session
sir.
very lively and the very illustrative, nice, useful presentation by Dr. Huddar based on various case scenarios, because this has given orientation for the participants who are not in the domain. And definitely people have mentioned that they are getting encouraged to see all these experiences to make them enable for their further career. So that was the only aim for a particular such webinar, that make this domain, this knowledge that into the domain to be shared by various among the people who are in the stakeholders, especially. So that was the only purpose, and I think that's achieved now. I think so.
Thank
Thanks
you.
to Dr. Uddar for sparing your valuable time. I know that today is your OPD day, and out of that busy schedule, you came
Again, I
here
have to go now.
almost, yeah, almost one
Yeah.
more than 1 hour. We have kept you engaged here. But thank
Yes.
you very much, and also
Thank you, sir.
thanks to all the
Thank you for the
participants.
opportunity. Thank you, Govind Reddy, sir. Thank you, Manohar Gundeti, sir. Thank you.
Yeah, we'll see you again on the web.
Thank you, boss.
Thank you.
Yes.
Web conference on 19th, sir. On that
Sure.
day,
Yeah.
again, you will be invited
Sure.
to share your experiences.
Sure.
And now, I thanks to all the participants who have made this webinar successful, and all the team from our CCRS headquarters, my colleagues in Cary, Mumbai, and our institute head, Dr. Govind Reddy. So thank you, and see you then tomorrow. Not tomorrow. We'll be meeting on again 15th.
15th.
Third webinar. This will be an interesting topic where a modern medicine doctor, also trained in Ayurvedic system of medicine, will be talking on about the integration aspects. His OP, Professor Vitthal Shamrao Patil. Professor Vitthal Shamrao, you want to ask anything? Okay. So, okay. With this, so we'll see you again, all the participants who have been registered for the third webinar. We have posted the flyer, and the registration link is again posted in the same flyer. Please do register for remaining webinars. Those are on 15, 16, 17. And soon we'll be floating the flyer for the web conference, which is scheduled on 19th of this September. That will be a 2-hour session, and we look forward to further sessions. So thank you. Good evening all. Thank you.
Good evening.
Thank you so much, sir. Thank you. Thank you for the information and the help and answer all the questions.
Thank you.
Thank you, ma'am.
Thank you, sir. Thank you.